This video demonstrates the procedure of placing and removing a Passy Muir valve, PMV, in a spontaneously breathing tracheostomy patient. This video should be used in conjunction with the OPIC Passy Muir Valve PMV use in spontaneously breathing patient clinical procedure, which contains detailed information regarding the procedure, as well as when not to place the PMV, when to remove it, and who can place the PMV. Explain the procedure to the patient. Ensure that the patient is in a comfortable position. Prepare all necessary equipment. This should include routine tracheostomy PPE as per hospital policy, a 10ml syringe, functioning suctioning equipment, the Passy Muir valve, and pulse oximetry, used during initial sessions or if the patient's status changes. Perform hand hygiene and put on PPE. Note the patient's baseline observations: heart rate, breathing pattern, respiratory rate, and SpO2. If a suction aid tracheostomy is in situ, use a syringe to aspirate the suction aid line to clear subglottic secretions. Suction via the tracheostomy. Completely deflate the cuff and suction simultaneously via the tracheostomy. The cuff must be fully deflated when using a PMV. Check the pilot balloon to ensure the cuff is completely deflated. Secure the tracheostomy tube with one hand, and with your dominant hand, place the PMV on the tracheostomy hub with a quarter clockwise turn. If the patient's voice sounds wet or gurgly, there may be secretions in the upper airway. Encourage the patient to cough those to the mouth. Clear the mouth with a Yankauer if required. Ensure the patient is comfortable and able to voice.
Let's hear your voice, Colin.
It's good.
Excellent.
If the patient cannot voice or demonstrates changes in heart rate, breathing patterns, respiratory rate, or SpO2, or is visibly distressed, do not use the PMV. Contact the speech pathologist. Monitor the patient closely for signs of intolerance of the PMV, such as increased work of breathing, respiratory distress, anxiety, increased coughing, or desaturation. Remove the PMV as per documented schedule or at any time that the patient does not tolerate the PMV.
So to remove the speaking valve, we'll place one hand on the tracheostomy hub, and then with a quarter anti-clockwise turn, we're going to remove the speaking valve. Re-inflate the cuff as required.
Document the duration and tolerance of PMV use in the medical record.